It's estimated that 100 million Americans suffer from chronic pain. That's pain that lasts 6 months or longer. For those who suffer from chronic pain, the pain can range from minor discomfort that's merely inconvenient to excruciating pain that's debilitating. And for those with chronic pain, it can also be hard to explain it to others.
Pain's invisible and you can't see it, and people look okay. It's hard to really believe that they have pain. It's really important for that person with pain to take an active role in their health care.
For those with more severe cases of chronic pain, drugs known as opioids are often prescribed. They can provide much needed relief, but have hidden dangers as well.
Some of those medications most commonly prescribed are things like morphine, oxycodone, codeine. And if you are prescribed this medication, you need to talk to your doctor about some of the things that you might look for if you're going to have an accidental overdose.
Getting the word out about the dangers of these commonly prescribed drugs and how to recognize the negative side effects is part of the goal of a new campaign called America Starts Talking. The campaign's website, americastartstalking.com, is filled with information about these drugs with the hopes of promoting open conversations between those with chronic pain, their doctors, friends, and loved ones.
Every day, there are 44 people who die because of prescription opioid abuse, and 80% of those are unintentional, so it's really important for us to get that word out.
And because these drugs are so powerful, many times opioid emergencies can occur even in people who are taking the medications properly.
For example, elderly patients, if they have a condition or a disease, if they metabolize the drug a little bit differently, if they take many medications, they may have a drug interaction. So this is unintentional, and they may not even realize they're having an opioid overdose.
The symptoms of an overdose can be disturbing, but there are things that family members can do if an overdose occurs.
If someone has slowed breathing, absent breathing, very small pinpoint pupils, if their fingertips become blue, if they lose consciousness, these could be critical signs that there needs to be treatment that occurs immediately. And there is a medication that can reverse this, known as naloxone, that family members, loved ones can administer to that person and take them to 911 to potentially save their life.
And that's really why we're here to talk about the americastartstalking.com website, to help people is that first step to where do they go to get information and how do they have that conversation with their healthcare provider. There's a discussion guide there to really help them understand what they should be asking and the questions they should be asking. There's also one there for their family members. There's a quiz there to test their knowledge about what they should do in case of an opioid emergency. And there's also resources there, and there's a great video that's going to help explain it.
And for those affected by chronic pain, it is an important discussion to have. And a great place to start that discussion is at americastartstalking.com. Bringing you the best of California, I'm David Wiley for California Life.